As the United Kingdom braces itself for a tidal wave of Omicron, Prime Minister Boris Johnson has launched a campaign to accelerate the rollout of booster vaccines. Is the United Kingdom panicking a day after the first death was reported in that country because of Omicron? Take a look.
The UK government is racing against time to speed up its booster vaccinations for all above 18 years. The government has sounded an alarm over the super mutant and its spread, even as the first Omicron death was reported.
And we know from bitter experience how these exponential curves develop. No one should be in any doubt. There is a tidal wave of Omicron coming. And I'm afraid it is now clear that 2 doses of vaccine are simply not enough to give the level of protection we all need.
The British Prime Minister has warned of a tidal wave. Authorities expect the country will have 1 million Omicron cases by the end of this month. According to latest reports, 10 people in the UK are hospitalised with Omicron, a number that could rise.
Overwhelmed NHS is not a good sign for the whole entire country, not even for those patients who won't be affected by COVID. The best weapon we have against Omicron right now, according to data, is the booster doses.
People coming from other countries like India on vacation in the UK are being given booster jabs.
Anyone who's living in the UK and who had the second dose 3 months prior to the booster dose, so anyone who wants the vaccine, they can come and have it, but it has to be over 3 months.
I'm really thankful and excited about it because others in India going without booster dose, you won't get it. मिलेगा नहीं फिर वहाँ तो मिलेगा नहीं 6-7 महीने तक नहीं रहेगा. So I'm happy कि मेरे को यहाँ मिल रहा है.
Restrictions will return ahead of Christmas and New Year. The last time UK eased restrictions was in June this year.
With especially Prime Minister Boris Johnson calling it a tidal wave of Omicron here in the UK, COVID passes being debated upon during New Year time. It is a desperate measure and to surge in booster vaccines so that one can save the Christmas, but also people, because the infections are rising in the UK and the first death has already occurred because of Omicron. Lavina Tandon for India Today from London.
The first death because of Omicron in the United Kingdom. Is that enough reason to panic? Professor Sanjeev Krishna, molecular parasitology and medicine, St. George's University, joins me from London. Appreciate your joining us, Professor Krishna. Is there a sense that the United Kingdom is panicking too early? The UK Prime Minister saying there's going to be a tidal wave of Omicron cases?
Thank you for having me, Rajdeep, and good evening to everyone. I think it's not so much a sense of panic as a sense of appreciating what we know so far about Omicron, and then being very alert to what we need to know. So what do we know? What we know is that it is clearly far, far more transmissible than the other variants we've seen before, including Delta. So this virus is itself a super spreader, if you want to put it that way. What do we not know? What we do not know really is in the 3 different populations that we already have, both in the UK, in India, and in the rest of the world, how this virus is going to behave in terms of severe disease and deaths. So what are the 3 populations? Of course, you have the unvaccinated, for whatever reason. And within this, you may have vulnerable groups like pregnant women, children, say, over the age of 5, and so on. Then you have those that have been infected, and those who may then have received a vaccine. And then finally, you've got the 3rd group who are vaccinated. And in that group, what we know is that 2 doses, even of the mRNA vaccine, which does produce better responses than, for example, AstraZeneca, even within that group, it is the infections which are increased with Omicron compared with Delta.
But the hospital.
We
But if I may
expect and we
intervene,
hope-
Professor Krishna, hospitalizations as of now have not increased. So there's no sign that Omicron will lead to hospitalization, and there is some reason to believe that a booster dose, if given now, will actually ensure a certain level of immunity. So, is it reason enough to believe that Omicron could be like Delta, spark of another wave?
Well, these are very important questions. Hospitalizations are increasing in the areas where they were first described, but we have to bear in mind this is such early days. It was only the 23rd of November that the sequence was identified, and where are we now? And it takes weeks before people become sick enough to need to be hospitalized and then perhaps go on to ITU and then suffer bad outcomes unless they have other complications as well. So we have to just be very careful. I think what we're seeing, is a different way of looking at the virus as well, because the world is now alert and everyone is very ready to try and respond appropriately because people have been caught out before. The UK was very slow to respond in the first and second waves of infection. And, we have to be alert to this. But throughout this, while we're having debates about vaccines, it's not only about vaccines. It's also about testing. It's also about taking simple preventative measures. Don't go into big groups. Test regularly and then do all the other COVID secure precautions that your listeners will know very well by now.
Okay, let's leave it there. Clearly, the jury is out at the moment as to how contagious Omicron is going to be in terms of actually resulting in hospitalizations. We know that there are reinfections, and we know that we need to be therefore careful and on guard. Professor Krishna, thanks very much as always for joining me there from London. Thank you.
My pleasure.